bringing news that matters to you. You're watching the Bahamas Tonight Northern Edition.
Summer heat continues to be a hot issue. Officials from the Met Office are not the only ones expressing concern about the sweltering conditions. In fact, health professionals are on a mission to educate the public about some telltale signs to look for in order to avoid the threat of a heat-related emergency. Officials say the summer heat and scorching temperatures could prove to be a challenge for the elderly, persons with disabilities, and small children. Clinical Director and Emergency Medicine Consultant of the Accident and Emergency Department, Dr. Michelle Sweeting, urging residents to stay hydrated. She says it is also important for family members to pay particular attention to the care they provide for their loved ones.
The very old, the very young, and those with debilitating diseases, whether it is physically or mentally, they cannot sometimes readily remove themselves from situations where the temperature is not helpful. So these are persons that you have, family members, friends have to pay special attention to make sure that they are in the proper climate, they're properly dressed, they're properly hydrated. And we talk a lot about fluids, but remember, it's what we eat also.
The medical doctor says persons can suffer a range of heat-related health problems, starting from heat cramps, heat exhaustion, and in a worst-case scenario, heat stroke. Dr. Sweeting says that in extreme cases, recovery time may be longer than you think.
If we catch it in the early phase, it's pretty good, and with hospital stay may vary from 1 to 2. Remember, all heat strokes, most of them are going to be admitted, and hospital stay for early heat stroke may be from 1 to 2 days. But if it is severe, where the patient comes in already have respiratory problems, pulse and heart beat is out of control, their normal mental status is not there, they're confused, then it's going to take quite a long time. And some of these patients, they never really get back to normal, or getting back to normal take months, and there are even cases of perhaps even almost a year.
Registered nurse in the Patient Education Department, Tanya Barbs, says it is important for persons to pay attention to their symptoms and to take the necessary steps when you recognize these signs. She says that a heat stroke untreated can be fatal.
And if left untreated, can really be damaging to the brain, the heart, the kidneys, and the longer you take to get treated, the long-lasting the effects are. So we want patients to be able to recognize those symptoms immediately, be able to know what to do from home, and then still be able to come in for us to further manage their case.
Dr. Sweeting says that a heat stroke is considered a medical emergency, and persons should present to the Accident and Emergency Department if they feel they are suffering. Megan Shepard said. A division of the police summer camp taking the annual program to another level as officials focus on the environment. Sabrina Brown has more.
With large garbage bags in hand, 37 campers from the Police Eastern Division Summer Camp assembled at Xanadu Beach Friday morning for a cleanup campaign. Coordinator Sergeant Lamardo Bo says this initiative is a significant part of the program.
We encourage our campers to give back and to keep the community clean. We've had a representative from the Keep Grand Bahama Clean Committee, and they spoke to the campers about dealing with the environment, the importance of collecting litter, the importance of putting litter in its proper place.
Sergeant Bo says some items often left at beaches pose a great danger to the environment.
There are certain items that really hurt our environment, things like styrofoam, things like plastic bags. And so those are the items that the campers would be focusing on, along with things that are left behind by persons who use the beach on holiday time, such as the bottles and the cans.
These campers say they learned an important lesson through the cleanup campaign.
People destroy our beaches, and it's not good because the plastic and styrofoam, they go into the water and hurt the fishes.
There are a lot of things that can kill the animals on this beach and cause a lot of jobs to go wrong and cause people to move to different places, and as a result, business can go down.
It's going to help protect the beaches, and it's going to help with the job income.
Sabrina Brown, ZNS Network News.
And now it is time to ask the doctor.
Welcome. Yvette asked, over the last 4 weeks, 6 members of my family contracted what we believe to be pink eye. The symptoms were severe and lasted anywhere from 7 days to 3 weeks. Everyone who had it experienced pink eye at a much earlier age for about 3 days only, and the symptoms were much milder. Was our recent experience really pink eye, or was it something else? Yvette, thank you for your question. What is commonly called pink eye is what we call conjunctivitis. It is an inflammation or infection of the conjunctiva, which is the clear covering that lines your eyelid and covers the white part of your eyeball. When small blood vessels in the conjunctiva become inflamed, they're more visible. This is what causes the whites of your eyes to appear reddish or pink. Pink eye can be irritating, and treatment can help ease the discomfort. The answer is yes. You and your family's recent experience sounds like pink eye because it can be contagious. So early diagnosis is important because medications such as antibiotic eye drops can help limit the spread. I'm Dr. Monique Pratt, and this has been Ask the Doctor.
Don't go away, Ricardo Lightburn is up next with a check on sports.